HealthChain was a project funded by I3, the Interregional Innovation Investment Instrument from the European Commission. One of the main benefits of this model is that companies with mature solutions can test them in real healthcare settings, which is very difficult for them or very expensive without this kind of initiatives.
One of the key areas that we have been working in HealthChain is building ecosystems. Ecosystems are a key aspect into regional development. The roles that we have organized is healthcare organizations, cluster organizations, and companies, and they've been working together in order to deliver the solutions.
So we brought together these partners, and when we started working, we saw that just having a good technical solution is not enough. You have to have a technical solution which is confirmed by the user.
The interregional path is not always the easiest, but it is definitely the most powerful one. So if we want to compete globally as the European Union, we really need to collaborate between the regions.
Yeah, if you focus on innovation, you have different forms. So you can start like really small, and it means that you focus solely on a small innovation that, for example, is not interoperable with hospital systems or with the infrastructure or the existing care processes. So you can really focus on its feasibility of that innovation.
Co-creation was quite a new thing for us at that moment. Not that we didn't do it in the past, but it was never done so systematically.
It's not just implementing technology, it's also about people doing things differently. And that's a big gap.
Business support is very relevant when you want to bring solutions into the market. But in HealthChain, what we have done is really tailor the support to the company's needs, what they really needed, not in a general way. That way we can unlock the potential of the development in the regions. So you need to understand which are the companies, what they are doing in order to support them.
Thanks to the business support we received, they didn't just have a solution that could be able to put in the market. They had a more solid go-to-market strategy and a more solid business model. Thanks to this mentoring, validation, and access to healthcare decision makers, they also were able to adjust their pricing strategies and to be able to not just have a model that could work with the hospital, they pilot the solution, but to have a model that could be able to be scaled across Europe in different healthcare organizations.
Well, in fact, an important advantage of participating in this kind of co-creation processes with healthcare organizations is that you can address other healthcare organizations in order to present this with the seal that you have got from the first one that has helped you in co-creating this.
If you're looking at more regions, already interacting with more healthcare organizations, you're going to be quite successful in implementing your product at a later stage in its development process.
We also involved additional 15 regions in our community of practice with the goal of sharing this demand-driven innovation model and transferring best practices from what we've learned.
The biggest added value is the community, the fact that you come together, that you discuss issues, gaps, fixes, together with other SMEs, with other healthcare organizations within Europe and within your own country, but also outside. And you gain knowledge about how they actually achieve their results.
Usually the companies which are delivering pilots are asking themselves about the future only at the end of the piloting session, you know. And the beauty of the HealthChain project is that it forces SMEs to start thinking about it earlier in the project.
HealthChain, I think, proved very strong interregional collaboration, But that was actually a bit difficult in the beginning because we were a new team, we didn't know each other. Healthcare is also very localized because it depends on like local language, local patients, how healthcare is organized locally. So in the beginning it was a bit difficult to achieve that initial interregional cooperation. So if the project started today, I would try to encourage that to happen as soon as possible.
If you want to embark on this adventure, you have to have really clear vision of which case or module or problem you want to solve. You still have to do work yourself, but consider it more of like an accelerator on your company or your product and use the power of the network to gain advantage.
And I also would recommend to start, because some things you will discover along the way, and it's very important to be flexible, to be able to adjust, but start, work together and start.
I think the good thing about HealthChain is we learned by doing, and we really were able to modify things that we had planned originally in order to get a bigger impact. So I'm very proud the way we did it.